Let's go. My name is Dr. MarkAlain Dery. I'm the Medical Director of Infectious Diseases and Chief Innovation Officer for Access South Louisiana. I live in New Orleans, Louisiana. I serve as co-chair for the ACOI Infectious Diseases Subspecialty Section. Now, you've seen me do these updates now for over a year in conjunction with the leadership of the ACOI. Hello, ACOI. And I hope these messages are helping you keep up with the latest on COVID-19. I know many of you are continuing to fight, and for that effort that is centered around convincing individuals to get vaccinated, we thank you. Wherever you are in the battle, again, I'd like to thank you on behalf of all of us who focus daily on infectious diseases, and certainly on behalf of the ACOI and the leadership of the ACOI. Thank you, ACOI, for letting me do these videos. Moving together with the ACOI, we will continue to share information as it becomes available, as well as some of the hopeful progress that we are seeing. On to the stories. We have so much good news to talk about today. So, in public health, it seems that there aren't enough times where there are magnificent breakthroughs that overwhelmingly exceed expectations. The science and technology behind the COVID-19 vaccines powered by messenger RNA, or mRNA as we now have come to call it, I'm happy to say is one of those achievements. Not only are the mRNA vaccines proving to be exceedingly safe, but they are increasingly shown to be effective against the rampant variants that have popped up around the globe. Nasty variants. All right. Or I like to call them the vicious variants as well. Now, this technology may have uses in old enemies like HIV and RSV. And additionally, it is being tested for cancers and brain tumors and could be effective in treating autoimmune diseases as well. Now, the history of the development of the mRNA technology dates back 30 years to the early 1990s when a University of Pennsylvania researcher who was born in Hungary. So we love our immigrants. Thank you. We can't get enough of them. They bring amazing technology to the U.S. And just reminding everybody that Steve Jobs' father, the inventor of this machine right there, also immigrated, I think, from Lebanon. Anyway, this researcher began testing for gene therapy. These researchers use a cookbook analogy to explain that the DNA in your body is the cookbook, and messenger RNA, mRNA, is a copy of the recipe, and it disappears, but it leaves behind the cooked product, which is the body's immune response, which lasts beyond the mere recipe copy. Now, that's the miracle of the vaccine. They instruct your body how to make the recipe, then off they go to let your immune system to do their thing. We love that about the immune system. So what's the mRNA technology? What the mRNA technology does is eliminate traditional time-consuming vaccine creation and the hurdles associated with it, including the step of having to isolate the virus, learning how to grow it, inactivate it, purify it, all of which could be months to years of work. So the mRNA technology only requires just a piece of genetic sequence. No sample of the virus is actually needed. The present-day mRNA vaccines began being created when the Chinese released the sequence of the SARS-CoV-2 virus, and within a matter of weeks, they had already created the vaccine and actually started with animal studies. So before the pandemic even hit, that Hungarian researcher that I mentioned earlier, her name is MarkAlain Dery, was starting clinical trials on mRNA vaccines for influenza, including one that will protect against strains of the influenza that rapidly mutate. So there's a potential for this immunity for years with just one shot, potentially eliminating a yearly flu shot. How awesome is that? So those same researchers are working on HIV, and they're studying ways to fight Ebola, Zika virus, rabies, and even pneumonia and cytomegalovirus, as well as RSV, a virus that doesn't just affect kids, but is also responsible for killing around 14,000 adults each year over the age of 65. Now, thankfully, some of this pre-work that was done on mRNA technology set researchers and vaccine developers up nicely for success when the pandemic came around. Back in 2016, while working on the SARS and MERS virus research, they discovered how spike proteins can be used and stabilized, which made them prepared for today's pandemic. So, looking to the future, the mRNA technology does have potential for malaria, TB, and other organisms, other viruses that in the past have been tricky for scientists to conquer. So Moderna is now working on a personalized cancer vaccine, and as stated on Moderna's website, the vaccines have huge potential in fighting each patient's individual battles with malignancies by identifying mutations found on patient cancer cells. How cool is that? Then the computer algorithms are used to predict 20 of the most common mutations that they may be able to create a vaccine then that will encode for each of these mutations and then loads them onto a single mRNA molecule, which is then injected into the patient to try to help orchestrate a better immune response against the tumors. Again, that's brilliant. So this mRNA technology also has the potential to fight autoimmune diseases, Lyme disease, sickle cell, and who knows what else. But I know as an HIV provider, a vaccine that could potentially prevent HIV would be amazing. And certainly I think that the technology that mRNA brings to the table is remarkable. And we're so happy that it's here. And again, like I mentioned, good news, good news, good news. And more good news, because the next set of stories are all about the fact that cases are going down. Brilliant. Again, good news. Finally, I get to say this. COVID-19 cases and deaths are at the lowest level since March of 2020. How awesome is that? We've reached a daily average of 15,600 cases per day, a 30% decrease from just prior 7-day average and close to 100% decrease since January of this year. That was just 6 months ago. So cases are so low, in fact, that Axios, an online news site, has a cool animated map that shows the case fluctuations per state over time. Check it out in the resources link below. But once again, the cases are so low that this week is the last week they plan on publishing their COVID tracking map. So what do we have to thank for this encouraging trend of less cases and deaths, you ask? Why the vaccine, of course? We are now at the place where nearly 63% of all adults have received at least one dose of the vaccine, but it is still concerning that the vaccination rate is dropping. Yet the president is still hoping for the goal of having 70% of all adults vaccinated by July 4th, and there's all kinds of incentives out there, from lottery jackpots to free beer. Now, the White House has just announced a partnership with Black-owned salons and barbershops to be part of a Shots at the Shop initiative. I believe the biggest incentive of all should be the protection that the vaccines are providing against the virus. But having all these extra incentives and motivators could help this country finally get to that elusive herd immunity, and I think that's smart. Yet what our patients need to understand is that these falling numbers don't mean anything unless you are actually vaccinated. It needs to be made clear to them that they are not protected if they haven't had the vaccine. In fact, for those that are not vaccinated, the pandemic is actually still raging on. COVID cases and the death rate is the same as it was last year for those individuals who are not vaccinated. Let me say that again. For those that are not vaccinated, the pandemic is still happening. The case rates and death rates amongst the unvaccinated are the same as they are as it was in December, when we had the beginning of our peak. So the misperception that exists among the unvaccinated is that they think it's safe not to wear masks since numbers are so low, and if you don't have a vaccine, you are still in danger, and we need to get our patients to understand that. The risk of death and hospitalization is significantly more prominent for those who are unvaccinated. And in many states like Florida and Maryland, the unvaccinated are at least 50% more likely to require hospitalization. And in some states, they are twice as likely to require hospitalizations. The death rate is also higher for the unvaccinated. In states like Michigan and Pennsylvania, the adjusted rate is 50% higher than the national adjusted rate. Yet the good news is that more than 12 states now have 70% of their adult population vaccinated, and many more states and territories are on the way to crossing this mark. The rest of the country, and some states at least, have a long way to go. For example, Alabama, Louisiana, Mississippi, Tennessee, West Virginia, Wyoming all have less than 50% of the population vaccinated. I know here in Louisiana, we had a great initial rush. I think we were in the first couple of states that were in the top 5, and certainly New Orleans, where I'm broadcasting from, has some of the highest rates of vaccine completions in the country. But getting out to the rest of the state is important for us, and finding these pockets of those that are unvaccinated and encouraging vaccination is incredibly important. And remember, folks, that those that are vaccine hesitant, doctors are very, very influential for them. And so please take the time, as I do with my patients, to encourage vaccinations for everybody. So that being said, stay on the lookout for our regular updates. To read more from the sources used in this report, go to the acoi.org/COVID-19. Together with the ACOI, will help you stay on the latest information to help you stay on top of what's happening, responding to your patients, and again, staying on top of the crisis. Please feel free to reach out to me anytime. I love hearing from you at madery@mac.com. Please stay safe. We can do this together.